Everyone, it's Russ Curtis, Professor of Counseling. Thanks for joining me today. This is something we talked about on an integrated care presentation. So, all behavioral health providers and clearly medical providers need to understand the psychological aspects of irritable bowel disease, which is really chronic inflammatory conditions affecting the GI tract. The two primary ones that you hear about are Crohn's disease and ulcerative colitis. The cause is kind of unknown. They'll talk about genetics, they'll talk about microbes and so forth. One that does come up, and I don't see it enough, there's been a class action lawsuit related to this, is that the silent chemicals, PFAS and PFOAS, are linked to ulcerative colitis along with some other cancers as well. There has been a class action lawsuit showing this link with over 3,000 people. Some of the symptoms of irritable bowel disease, whether it's Crohn's or ulcerative colitis, is pain, bloating, diarrhea, fatigue, anemia, because there can be a lot of blood loss, and unintended weight loss. This creates issues in almost all aspects of life. If you're having to frequently go and you can't trust yourself to where you can be, it's going to affect your relationships, intimacy, of course, employment. You can't really be in a real customer serving type of profession, or it makes it very difficult that if you can't just get up and go immediately. How you exercise, and if you want to exercise, you don't want to go on a run if this is an issue. And also nutrition, because you're not maybe absorbing as much, and what you do eat is not staying to nurture your body. Also, very important to keep in mind, the stress managing a chronic illness like this leads to anxiety and depression. If you think about all the areas we just talked about that are affected, and then the anxiety and depression can affect the GI tract clearly. So, just making behavioral health providers aware of all the things that go on with this, it appears to me this is one that's not talked about a lot, and I think counselors need to ask about it. It should be perhaps a part of an intake to find out what types of medical issues folks have, and I think that does happen. But let me know your thoughts on this, and we'll talk to you in the next video. Take good care.